We performed a retrospective analysis of the impact of sequential immunotherapy in endometrial cancer. Immunotherapy, or IO, has transformed endometrial cancer treatment, offering durable responses in select patients. Notably, it was first approved for endometrial cancer in the recurrent setting following Keynote 158 and 775 trials, marking a paradigm shift in management. More recently, IO has moved into the frontline setting for advanced and recurrent disease following the RUBY and NRG GY018 trials. However, no prospective studies have evaluated IO in the recurrent setting among patients with previous IO exposure. So our study evaluated the clinical outcomes of patients with endometrial cancer who received IO after prior IO. This was a retrospective analysis of patients from two large academic institutions, including Dana-Farber, who received a sequential IO at least 2 lines between June 24th, 2019, and the data cutoff date of January 29th, 2026. We identified 22 patients who received at least 2 lines of IO, and 2 of these patients went on to receive a 3rd line of IO. Most patients had stage 4B at diagnosis, this was about 70%, and endometrioid histology in about 45% of patients. Around 3/4 were pMMR and 1/4 were dMMR. Most patients received frontline IO plus carboplatin and paclitaxel, followed by IO maintenance. This was over 50% of patients, and pembrolizumab and lenvatinib as the second IO treatment in over 75% of the patients. Duration of the second IO ranged from 1 month to 2.4 years, with a median time of treatment time of 4.7 months. Certain patients derived significant clinical benefit from the second IO, with 8 patients on therapy for greater than or equal to 6 months, including 3 patients for over 1 year and 1 patient with treatment for over 2 years. Of note, most of these patients had already progressed on prior IO, 75% of the patients, and most commonly, IO was discontinued for progression in both the frontline setting in over 75% of the patients and in the recurrent setting in 36% of the patients. Moreover, 1 patient stopped their second IO with no evidence of disease after 11 months on therapy and remained in remission at the data cutoff 3 years later. 8 patients, 36%, were still receiving their second IO regimen, and 2 patients receiving their third IO regimen. This was 9.1 patients at data cutoff. Therefore, our results show that select patients derive benefit from sequential treatment with IO, regardless of MMR status or progression on prior IO. This retrospective study suggests a continued role for IO in treating certain recurrent endometrial cancers after prior IO exposure, and further work is needed to identify those patients who will continue to derive benefit from sequential IO therapy.